Hello there, I'm Dr. Purnendu. I promised you that in this channel of mine, YouTube channel, I'll keep bringing topics that had caused concern, and we will keep talking about education and certain symptoms and diseases. There are several places where you can go and look for top 10 dangerous diseases, top 10 killers in the world. There are many things like top 10 symptoms you should not ignore. No, I don't want to make a shopping list and categorize which is the 5th highest cause of death in the world, road traffic accident. Should I start talking about tuberculosis and malaria? No. I'm going to start with a simple thing which all of us ignored, including me. That is snoring. When somebody starts snoring, the person always gets the feel that it's not causing any botheration for me, it's just the other person who can't sleep because I make noise. So why should I be concerned? Now, have we tried to understand that what exactly is this snoring? There is an obstruction in the breathing passage. The soft tissue in the pharynx area causes obstruction when we sleep, and that causes a breathing difficulty, and with the vibrations over there the snoring noise comes, and sometimes there is sleep apnea. Let me just tell you what are the symptoms, what happens. One, yes, barring about the spouse or the person who is not able to sleep, the main things that happen is very disturbed sleep in the night and suddenly jerk and breaking off from sleep, whole morning feeling of sleepiness and tiredness, irritability, difficult in concentrations, and signs wise, people who actually have obstructive sleep apnea, they tend to have high blood pressure, they tend to have high heart disease, increased chances of heart attack, increased chances of irregular heartbeats rather than arrhythmias, and also there is a higher risk of sudden death in sleep. Many times we people say that he didn't suffer, he silently died in his sleep. Did we investigate why did somebody die in his sleep? So what is it that the solution? If any person who is having these symptoms and snoring, they should have a sleep study, and this is called polysomnogram. During sleep, we do the study of the EEG pattern, the pulse rate, oxygen saturation, and we try to see how many apneic spells, which means stopping of breathing, takes place. If this apneic index is high, in one night of sleep study, if there are multiple sleep apnea, which is obstructive sleep apnea causing place, this person needs treatment. And these treatments are in the form of one which is called Cpap machine. Continuous positive pressure which is created, this continuous positive pressure ventilation, that keeps the breathing passage open. And there are different methods of how this thing is done. Weight reduction is the other things. Not sleeping on your back, sleeping on the side, and several other advices. Now, if this treatment is done for people who are suffering from sleep apnea, their blood pressure gets controlled, their concentration and ability to work and energy increases in daytime, and all the high cardiac risk decreases. So please, if you or your partner or your friends who knows or who is having snoring, don't ignore it. Just go for sleep study, polysomnogram, and take help and do the treatment for it. Please subscribe to my channel to get more updates on interesting topics on health and education. Like it, share it, and also please give your comments, because this is not only for viewing. Whatever comments and questions that you have, I'll personally answer all of them.